Welcome, everybody, to Indivisible TX Lege's hashtag Deadly Deregulation Healthcare Access and COVID-19 event. We are really excited to be with you today. We have an amazing panel. To Indivisible TX Lege's Looks like we're getting a little bit of feedback here. Sorry about that. We're really excited to be with everybody here. It is with extreme honor and privilege that I get to introduce the two amazing healthcare huddle leads for Indivisible TX Lege, Meg Onum and Janet Dudding. Meg and Janet, looks like you guys are on mute. If you want to unmute yourself, let us know how you're doing today this Wednesday.
Thank you, Alex.
Whoops, doing great. And it just wouldn't be a Zoom without a little bit of hiccup on the tech side. So thank you for making me feel better for all of the Zooms that I host all by myself. So doing great. It's beautiful outside. How about you, Meg? Today is the anniversary of the COVID pandemic being declared by the World Health Organization. Actually, I think that's tomorrow. So yeah. And the day that Abbott's mask mandate comes off of the books. So it is it's quite a day.
Yeah, I guess not a good day, but also, I guess it's a day. Let's just say that. And I do remember, I think it was about exactly a year ago when that was like my last day of school before releasing for the spring break that lasted eternity. And wow, what an eternity.
It's been a strange ride. It's been a great ride. I barely saw my husband going into spring break, and then spring break happened and he never went back to school. So he's been teaching from down the hall. I'm in Bryan College Station, home of Texas A&M University, and he's been teaching remotely ever since. So it's been a unique experience.
Yeah, definitely when it comes to education, just the pandemic in general, we, like several Texans, have been impacted in different ways. Janet, you mentioned your husband's teaching remotely. Meg, you referenced you're actually attending school remotely. And for all the Texans out there who are able to watch us, the amazing Meg Onum is our healthcare huddle leader while she's attending high school. And so Meg is truly amazing and is ready to keep and has been advocating for a better and brighter future in Texas and is doing that every day. So Meg, you're just an inspiration. And myself, I have two daughters. They've been attending school virtually and been impacted by the pandemic since last year's spring break. And so it's definitely something that's impacted us in various ways. And that's exactly what we're going to talk about today. So I'm going to hand this off to you, Meg, while I get this slide up for you to share and take us through some key points starting out.
Of course. Thank you so much, Alex. And, during this time in COVID-19, obviously healthcare is such a big issue because of this worldwide pandemic that has affected us for an entire year. Looking back, I think a year before today, I don't think we realized how immense the effects of this pandemic were. I know so many people who are like, oh, this pandemic will end in April. It'll end in May. Well, no, it's March of next year and it hasn't ended. And this brings up the topic of, how is the state of healthcare in Texas right now? And what can legislators do to help us in Texas right now with healthcare, with the deadly deregulation going on? And this kind of brings up the concern of what's been happening for the last few months. Currently, Texas is the fourth worst healthcare state in the United States. And that says a lot because currently, the United States is not in the forefront of the world regarding healthcare, and Texas even worse. And this brings up, how can we currently help healthcare in this state? Well, there's one simple answer: Medicaid expansion. So from this, obviously, as you can see here, Medicaid eligibility, not everyone is eligible for Medicaid in Texas. A lot of the adults and non-disabled adults and a lot of parents today are not eligible for Medicaid. Janet, if you would like to kind of go further on the specific model here.
Yeah, absolutely. People don't realize who all is eligible for Medicaid. Each state, it's a state-fed program. So each state determines their own rules in their own state. So our Texas legislators have decided that we will insure pregnant women, we will insure children, and we will insure disabled to a lesser extent and elderly. Legislators have decided. But once you have that child, 3 months later, you're cut off. We are not insuring parents unless you make less than Here, this slide from the Episcopal Health Foundation says if you make less than $3,668 a year, you're eligible for health insurance through Medicaid. Otherwise, you don't have health insurance. Your child will have health insurance through CHIP, but you won't have health insurance. And then childless, non-disabled adults are not covered at all in Texas. And it's just surprising to me that we are not valuing the health of our adults and our parents here in Texas.
Agreed. As you can see here, 1,274,000 individuals could be gaining Medicaid coverage when Texas expands Medicaid. And just to emphasize how big a number this is, I think throughout COVID, we always see numbers on our news channels. We see the number of deaths, the number of people who got COVID. And obviously numbers seem so insignificant to us, but when we kind of put it in this manner, it really kind of shows you some shock here. The equivalent of the population of Dallas is 1,330,612 individuals. That's almost the same amount of people who can get Medicaid coverage if Texas decides to expand it. Think about that in terms of a huge city, which is one of the top 20 cities in the United States. That many people could get coverage in Texas. And think of, section this out here, those numbers of people. There are so many veterans involved in this. There are so many parents. There are so many unemployed people who are currently involved in this number. So many people that could get coverage, who care for their families, who care for their workers, for their coworkers. They care for the other people who have been serving our country for so long. There's so many people with so many different stories involved in that number for Medicaid expansion. And imagine if our legislators took accountability and decided we are going to put healthcare first. This is the number of people who could get Medicaid coverage if our legislators decide to do that. And kind of going further on significant numbers here, 18.5 out of 100,000 people. That's the number of maternal deaths per birth rate in Texas, which is higher than the United States rate. Consider this. You have countries behind you. As you see in this model, we have France, we have Canada, you have the United Kingdom, you have Australia. Australia is an entire continent, and it's leagues below just Texas, a mere state in the United States. And it really shows you how bad the state of healthcare is. If the number before wasn't worse, it's crazy to think that, our life expectancy in Texas is just decreasing. The number of maternal deaths is just increasing. And it really kind of shows you the effects of deadly deregulation on Texas. And it really shows you how imperative this issue is in the era of COVID-19, in the era of healthcare, where so many people were dying due to the Texas freeze, due to COVID-19, due to everything that's currently going on in Texas. And we could solve this. We could decrease the number of maternal deaths per birth rate in Texas if we hold our legislators accountable. And kind of further going on this is the number of Texans who have died due to COVID-19, 45,000. And this is also equivalent to the city of Burleson, which is a population of 45,862 individuals, the 76th largest city in Texas. This may not seem like much, but to all the families who have lost their really important parents, children, grandparents, it's affected their entire lives, especially for the people who are currently unemployed and trying to manage their families in a single parent household, the parents who have lost their children. Imagine the effects of COVID-19 on these families. And our legislators are here prioritizing businesses over families, over people who could be insured with Medicaid. This is a big number when you consider all these individual lives. And this kind of brings up the concern that, if Texas keeps on saying that Medicaid expansion is too expensive, Medicaid expansion won't happen, these lives, these millions of lives that could be helped so much in terms of their financial situation and their healthcare, these millions of lives aren't being put first. The businesses are being put first. And this really kind of brings up the concern of who do legislators prioritize in this situation in the era of COVID-19?
All right, thank you, Meg. I think that was our last slide there. And that's just to provide some context for everybody as we go through this conversation. This amazing panel is going to dive even deeper into this. And before we jump into this panel, Meg, I think we have a statement we'd like to share with everybody, correct?
Yes, so we do have Rep. John Busey coming in from a video recording for us. Rep. John Busey is the state representative representing House District 136 in the Texas legislature. And just to kind of summarize what Rep. Busey does, he's very keen on expanding Medicaid this legislative session, seen with his help in the MedX for Texas virtual advocacy day campaign from Sick of It, Texas. He supports vaccinating teachers and frontline workers, supporting maternal care and mental health care, and of course, expanding Medicaid in order to save the Texas budget and save lives.
Hi, Indivisible Texas. It's State Representative John Busey. I serve House District 136, which is in Williamson County. It's part of Northwest Austin, Cedar Park, and Leander. I'm so happy to be with all of you today. Thank you for your committed work to helping to build the Texas that we all want. We got a lot of work to do this session. From my top priority, which is continuing the fight for Medicaid expansion. Medicaid expansion is the biggest tool we have right now to change the lives of Texans. If we were to pass Medicaid expansion, it would help over 2.2 million working Texans get healthcare coverage. It would bring home $110 billion of our tax dollars that we pay to the federal government. We can recapture that money back for Texas. And it would help lower all of our premiums. It's a win-win. It would not solve all of our healthcare problems, but it is the biggest tool we have, and we need to get it done. The fight for voting rights is real this session. We've seen headlines out of Georgia and other states. Well, that's happening right here in Texas too. I serve on the elections committee. I'm a former county party chair. Fighting for voting rights is paramount. Without this, we can't do anything else. So we have to keep up this fight, and that's going to mean having all of you here testifying, talking to your state reps and your state senators, and helping us pass good bills that expand access to the ballot box to everyone, and stopping bad bills that are trying to discriminate and rig the elections. So we need your help, Indivisible Texas, showing up day in and day out during the session as we fight for voting rights. Finally, we've got so many other pressing issues, from protecting our gains on public education funding from last session to working on pandemic recovery and recovering from the ice storm and figuring out how we're going to do better moving forward. And to do all of that, we can't do it without constant citizen engagement. So y'all play such a vital role in helping all of us try to get our jobs done. So I want to thank you for this opportunity to be with you today, and encourage you to continue, as you've always done, to keep showing up and keep working, and together we'll build that better Texas for all of us. Thank you so much. Have a great day.
All right, a huge thanks to Representative Busey and the amazing work that he's doing and everything that he highlighted in his video. Janet, we're going to hand off to you now because we have some amazing panelists that we want to introduce, and then they're going to be diving into some awesome content. Oh, there we go. Looks like you're unmuted. There you go.
And I'm live with video. Like I said, it's just not a Zoom unless you have a couple of little hiccups going along. So it just makes me feel more comfortable. Now, I've been lucky enough to have spent my share of time sitting bedside at a hospital table. We've been extremely lucky. We've always had health care, but I've got artist friends who are not insured. They're waiting until they turn 65 in order to get something with their health taken care of, and they're not making it. Here joining us today to help explain who qualifies for Medicaid is Melissa McCarthy with Every Texan. And I've got her bio information. Melissa joined Every Texan in 2015. She focuses on policy and practice related to outreach and enrollment for the Affordable Care Act, Healthcare Insurance Marketplace, Medicaid and Children's Health Insurance Program, which is CHIP, including access for coverage for immigrants. Melissa has provided policy analysis, training, and troubleshooting guidance to healthcare enrollment assisters across Texas. Prior to joining Every Texan, she worked as a senior policy analyst for the Texas Health and Human Services Commission on the team that implemented eligibility changes to the Medicaid and CHIP programs required for the ACA, the Affordable Care Act. Melissa earned a Master's of Science in Social Work from the University of Texas at Austin and a Bachelor of Science in Sociology from the University of Central Arkansas. After Melissa talks, we will find out about just how much Medicaid expansion will cost. You keep hearing that we can't afford it, we can't afford it, you can't afford it, you can't afford it. We've been hearing that for over a decade. So we'll be joined by Dr. Laura Daig, who will talk to us about the budget impacts of Medicaid expansion and her open letter to legislators. But for now, I'll hand it over to Melissa McChesney.
Sorry about that. Just getting my slides pulled up. All right. Spoiler alert, I was not on the very first slide. So thanks for inviting me, Janet, and the Indivisible Austin team. I will say, I've interacted with Indivisible groups across Texas, and Austin's commitment to healthcare and just the expertise that I see and the level of understanding that I see from this group, it's fantastic. I think you're making a huge impact on our push to expand Medicaid. So I'm going to go over sort of the basics of Medicaid expansion. I do have a few slides on the cost, but I'm going to skip over those pretty quickly so that I can leave that to the expert. In fact, she's cited in my slides, so it makes more sense for her to talk about them. But the one thing that we all have to sort of start with is that in Texas, we have the highest uninsured rate. So that's the highest percent of our population that's uninsured, but we also just have the highest number. So no matter how you cut it, whether we're talking about adults, whether we're talking about children, Texas does the worst in the country on ensuring that our citizens have access to comprehensive health coverage. We were doing better. We saw historic gains after the Affordable Care Act was put into place. However, we've been losing ground since 2017 with Trump administration changes to certain things around outreach and enrollment into the marketplace. We've definitely seen some impact from non-citizen populations, immigrant populations, just from fear due to anti-immigrant policies and rhetoric. So we've seen significant increases in our uninsured rate since 2017. I will say these numbers are reflective of as of 2019. The gold standard is census data, and it's always a little bit behind. And so this does not take into account the huge number of newly uninsured folks resulting from the pandemic and loss of insurance coming from our higher unemployed rate. So when you're talking about Medicaid expansion, one of the first things you have to start with is just who is in our Medicaid program today. And I do think that there's some misconceptions out there because people want to talk about Medicaid and like, okay, let's talk about Medicaid in Texas. We're talking about kids. We're talking about pregnant women. We're talking about people with disabilities. And we're talking about low-income seniors. So if you're going to do something negative to the Medicaid program, you're doing that to very vulnerable populations. We have more than 4 million Texans in Medicaid. Is actually growing pretty rapidly right now. And that is because right now under the Families First Coronavirus Response Act, so that's one of the very
Looks like, Melissa, we unfortunately you froze there for us.
first COVID bills that was
There you
passed
go.
year. Am I back up? Sorry,
back.
it didn't.
You're back. No worries.
Okay. Okay. I hope my internet connection doesn't get too wonky, and I might just turn my video off. I hate to do that, but I don't want to. I think it's because my daughter went back to class. So,
Totally understand.
So we do have that number increasing because anybody that is enrolled in Medicaid gets to stay there. So that means that we have 19-year-olds in the program where they typically would not be. And we have some pregnant women in the program right now that would have been terminated postpartum, but they get to stay in the program through the public health emergency. So we do see an increased number currently today. And then we've already seen a little bit of this, but just so you get a basic sense of our eligibility levels, in general, our top eligibility level for children is the CHIP program, and it's at 206. Now, just to point out for me, I've added in the 5 percentage point income disregard that's required. So that's why these look a little bit higher than the slides that Indivisible had. Just because this creates that actually impacts the population when we're talking about who is in the Medicaid Gap population. Ours looks a little different than some of the other non-expansion states, just because we have so many parents who are ineligible for Medicaid today. And the reason that number is so low is because the federal government has never mandated that the number be increased at the state level for parents. This is tied to old AFDC, so aid for families with dependent children. So a lot of times it was sort of commonly known as welfare. This was pre-welfare reform in the 90s. It was a program that was created, and this is actually a dollar limit. So we actually update it to reflect an FPL level so we can compare it to other limits, but this is a dollar limit that hasn't been changed in Texas since the 80s. So, and it's like $250 a month for a mom and 2 kids, which is just nothing. So it really is a very, very small amount of parents. So about 150,000 parents compared to the 3 million kids we have in the Medicaid program. So if we were to expand, we could have, I know that there's been a couple numbers thrown out here. We'll let Lisa talk about some of the differences, but it just has to do with how you slice the pie. But basically, we could be seeing 1.4 million. This is from Kaiser. I know earlier is 1.2. So it's around that number of uninsured Texans that would become eligible for Medicaid. So these are childless adults, but a big chunk of them are parents, and we'll talk about some of the demographics as well. Again, what I mentioned before, so just like our uninsured rate, these numbers also don't reflect the increase in the number of folks that would have been, that may have newly become in either they lost income and now are newly in the Medicaid income eligibility range, or they newly lost insurance, and so now they're uninsured. So we do expect the pandemic to increase the number of folks that are uninsured, and therefore increase the number of folks that could be positively impacted by expanding Medicaid. So as I mentioned before, we have a large number of parents in our Medicaid expansion program, larger than the average. So about 33%, so about a third of the adults in our program have a dependent under the age of 19 living with them. That's what that caretaker definition is. That's higher than the national average. If you average together all of the remaining non-expansion states, it's only about 1 in 4 instead of 1 in 3. So, and that is because our income limit is so low. However, so the other 2/3 are childless adults, and it doesn't matter how little income they make, they're just not eligible. So again, the next couple of slides are just talking about of those folks that could be newly eligible for Medicaid if we expanded. Let's talk a little bit about who those folks are. Most of them are working. We have a lot of jobs here in Texas that don't provide insurance. So I do see this common misconception at the legislature that, oh, well, if they had a job, they'd have insurance. That's simply not true. There's entire industries that do not provide health insurance to their workers. Or affordable health insurance. So nearly 8 in 10 are in a family with at least one worker, most of those full-time. And of those that don't have a worker in their family, often it's because it's a family where the head of household is a student, or the head of household is a caretaker for someone who needs to be taken care of, either because of their age or they may have a disability status. So there's legitimate reasons why someone may be considered a non-worker. so because they're doing some sort of unpaid work. So, and again, most of them are actually below the poverty line. So Medicaid expansion would provide Medicaid all the way up to 138% of the federal poverty level, but the majority are at the 100% are below, so 7 in 10 adults, which is unfortunate that we have so many adults who are working full-time to provide for their family and yet still don't make incomes above the poverty limit. We also know that Medicaid expansion would narrow racial disparities. After the full implementation of the Affordable Care Act at a national level, we saw historic gains in coverage in communities of color. But the states that were left behind, the communities that were left behind, are primarily in the South. If you're looking at non-expansion states, they're primarily in the South. And the impact really is disproportionate on communities of color. So 3 out of 4 of the folks that would be helped by Medicaid expansion are people of color, with 58% Hispanic, 13% Black, and 4% other. And so the next few slides, I'll just remind folks that while we are talking about the adults that could be directly impacted, we see the impact, it goes further than that. It's a whole family impact. So for example, we have what we call the welcome mat effect. We've seen it in other states. We've seen it prior to the ACA. Anytime you expand coverage to cover more adults, you end up with more kids getting in the program as well, because adults are just more likely to enroll their children if the whole family has access through the program. They're also more likely to take their children to the doctor. They're more likely to immunize their children. So we see not just an increase in the number of children who are insured, we also see positive health outcomes come through in the research. And again, just as I said at the beginning, we have the highest uninsured rate for kids in Texas as well. So in Texas, we have 12.7%, much higher than the national average. Again, the highest uninsured rate. In some of the states, Alaska actually used to have a higher uninsured child rate than we did, and then they expanded Medicaid and they significantly improved it. So we do see a positive impact on kids as well from Medicaid expansion. And as was already mentioned, the Medicaid expansion is the #1 thing that can be done to improve maternal and infant mortality rates here in Texas. This actually was the recommendation from the Texas Maternal Mortality and Morbidity Review Committee. Their #1 recommendation was women, if they want to improve health, we want to improve health outcomes in pregnant women, they need healthcare access before, during, and after their pregnancy. For low-income women here in Texas, they only get it during their pregnancy. So they come into a pregnancy with pre-existing conditions that haven't been treated, and then they lose coverage 60 days after, or 2 months after they have given birth. And that's just that's so soon. In fact, there's a really great campaign going on right now that I'll share with the organizers later, where we've gotten some interviews from women who, because of the public health emergency, they actually were able to keep their Medicaid for longer than they normally would have. And they were able to treat their preeclampsia, the remaining conditions that were resulting from things like preeclampsia or whatever it may be. They were able to continue to receive treatment and get themselves into a much better health outcome while they were able to keep Medicaid. So it's an important time to make sure women have access to healthcare. And unfortunately in Texas, they take it away far too soon. And then finally, people with disabilities. We talk about how so many of them can get Medicaid here in Texas, but as you saw earlier, the income limit's really low. It's only about 74% of the federal poverty level, and you have to qualify as disabled, which is actually considerably harder than one might think. So there are plenty of people with severe disabilities that are ineligible for Medicaid because it's simply either their income is too high or their disability isn't severe enough to help them qualify for SSI. So we know that in expansion states, once the states expand, they have just a higher percentage of their Medicaid population are people with disabilities than in non-expansion states. So it would be a very, very important thing to do for that population as well. There's a ton of research. We'll share these slides. It keeps growing. The last time Kaiser did this fact sheet, it was 300, and we have 400, that there are positive health outcomes and benefits to our overall healthcare system when a state expands Medicaid. We're one of only 12 states, and again, they're mostly in the South. And then again, I don't want to belabor this point because Lisa can talk about it, but there are a number of studies that have shown that we are leaving billions of dollars on the table, and we'll let Dr. Daig talk about the particulars of those. So the final thing I wanted to mention here, we are very excited to see the American Rescue Plan make it all the way through Congress and get signed by the president this week. We have every expectation that it will be. And in that plan, there are incentives for states to expand Medicaid. So right now, if you expand Medicaid, the government will pay 90% of the cost. The federal government will pay 90% of the cost. More typically, the federal government only pays about somewhere between 60 and 70% of the cost for Medicaid populations. So that incentive exists. That was created under the ACA. Now, for in the latest COVID relief bill, so the American Rescue Plan, they're actually offering for the first 2 years after a state expands, they'll increase their base FMAP for all of the other non-expansion programs. So everybody in Medicaid, they'll pay more of their cost at the federal level for 2 years. So it's really using that carrot instead of a stick to try to get the remaining 12 states in the door. And we've seen estimates from as high as $6 billion to $3 billion of additional federal dollars coming for this. We're still working out the exact differences, but some of it has to do with whether they're looking just at this incentive linked to Medicaid expansion, or if they're also including the additional FMAP that already is happening right now because of COVID. But we'll get more specifics on that once we get a final bill and are able to dive into some of those analyses. And then finally, Medicaid expansion is by far one of the most important things, but our Cover Texas Now does support other legislative priorities. So we need to restore outreach. We have over 600,000 people in Texas, the vast majority of them being children who are eligible for Medicaid but not enrolled in Medicaid. That's one of the reasons why we have the highest uninsured rates in the country for children. We also, one of the things that could help with keeping those kids enrolled is providing continuous coverage in Medicaid. We do that for the Children's Health Insurance Program. That's how private health insurance works. You only have to renew it once every year, but here in Texas for low-income kids, they're constantly losing coverage and churning out of the program mid-year because of bureaucratic red tape. So we'd like to see that removed. And then finally, we do support the extension of pregnant women's Medicaid for 12 months after postpartum. This would actually help, even if you had Medicaid expansion, if you did this on top of Medicaid expansion, it would help the women above the Medicaid expansion limit. So they also receive Medicaid even after they've given birth for 12 months. And I think that's my last slide.
Melissa, you and every Texan do such a good job at taking a very complex topic and making it digestible. Every time I hear from every Texan, I learn something. So thank you very much for joining us. Don't go anywhere. We might have questions.
Great. Happy to be here.
I really appreciate your being here, and I am so excited that Dr. Laura Daig is here. Y'all, I am an Aggie. I'm here in Bryan College Station, home in Texas A&M University, and so is Dr. Daig. Dr. Daig is an associate professor with the Public Service and Administration Department at the Bush School at Texas A&M University. She earned a PhD in economics from the University of Wisconsin. Her doctoral field of study were public economics and labor economics. She's a research associate in the NBERs, which I don't know what that stands for, but it sounds really big. NBER's Health Economics Program, and holds affiliations from the University of Wisconsin Institute of Research on Poverty, the Texas A&M Department of Economics, and the Texas A&M School of Public Health. She's an associate editor at the Journal of Health Economics. Her research interests are in health economics, particularly the economics of public health insurance. Her recent publications focus on changes in the Medicaid program and their relation to the federal healthcare reform. Current projects continue this work by considering how transitional Medicaid affects job transitions and the effects of expanding Medicaid to non-traditional populations, such as low-income adults without dependent children. She has a new project studying the role of paid leave on the work decisions of family caregivers for people with disabilities. Her work has been published in journals including the American Economic Journal, Economic Policy, Journal of Public Economics, Journal of Health Economics, Health Affairs, Health Services Research, Inquiry in Medicaid, and Medicare Research Review. Dr. Daigle, thank you so much for joining us. I'm a CPA and I love the weeds, so I'm looking forward to getting into some of the weeds with budget and some of your work. Thank you very much for joining us.
Sure, I'm glad to be here. And my plan is to talk through some of the budget math of Medicaid expansion. I think Melissa did a great job of giving an overview. So I'm going to use numbers that are based on a report that I wrote this summer with a student of mine at the Bush School, Constance Hughes, that we put out through our Mossbacher Institute at the Bush School and through the Episcopal Health Foundation, who graciously funded the work. We, I think, to kind of understand why sometimes the numbers are a little different from each other, it can be helpful to know where these calculations are coming from. And then you have the background that you need to really lay out the math and understand why, you know, it's this much here and it's this much there. So I'm going to talk you through some of that. I don't have slides because a lot of people's eyes kind of glaze over when they see like a bunch of numbers on a slide. And I don't think we need to really talk through this visually. But when you want to know how many people are eligible for a program like Medicaid in a state like Texas, as Melissa said, you really have to rely on some kind of gold standard data source like the census. And these are survey data that we have from folks responding. And so we are going to use what they say about their households, about their incomes, and about their current insurance status. Obviously, not everyone in Texas is going to be asked and respond to these questions. So the surveys get weighted up to represent the population. And then we use these answers and these weights to come up with an estimate of numbers. For smaller areas, that can be subject to more error, but for a big state like Texas, the state level numbers are usually very representative. So what Constance and I did is we first estimated how many uninsured Texans would be in the income and family status range for Medicaid expansion in Texas. And we found that it looks like there's about 1.4 million people in that range, according to the 2019 census data. So those are folks who are 18 to 64, and their incomes are, as if they're parents, their incomes are split too high to qualify for existing Medicaid, too low to qualify for Marketplace. If they're adults without dependent children, then their incomes are from 0 to the poverty line. Not to the poverty line, sorry, to the Medicaid eligibility threshold. And then we also are going to add in anyone who is getting existing coverage from the Marketplace, because federal rules require people who are in the Medicaid eligibility, who are Medicaid eligible to enroll in Medicaid and not use federal subsidies. So anybody who would be already getting federal subsidies for a Marketplace plan would need to shift to Medicaid if they're in the Medicaid eligibility range. Then, and this is, I think, where most of the uncertainty around different estimates comes from, you need to basically infer whether people are going to be eligible based on their immigration status. And that is something that's complex because we're relying on survey reports. There might be differential response to the surveys. And after we do our adjustments, which I can of course talk more about if you guys are interested in, we estimate that's going to be about 1,274,000 people. So that is the number that I think Meg showed you at the beginning. And that's where that's coming from. And then that's inflated to represent the 2020 population growth. So then we need to take that number. We know that not everybody who's eligible for benefits is going to enroll. We call this take-up. So we need to have an estimate of how many folks are going to actually enroll in benefits. And it would help a lot if we knew sort of more about the exact reasons that people don't enroll. Sometimes it's just that they're not really eligible, even though they look eligible on paper. But sometimes there are things like stigma about benefits or frequent redeterminations that cause paperwork issues that make them ineligible. This sort of things can happen. And there are some folks we just don't know why they might not enroll when they're eligible. But needless to say, we need to calculate it. We estimate in our main take-up scenario that about 73% of people we think are eligible would enroll. This is something, of course, that can be directly affected by policy, right? If the state works on outreach, if they try hard to get people enrolled, that take-up rate would go up. If they take another approach and make things more difficult, some states also do this, that take-up rate would be lower than we estimate. This is consistent with modeling from places like the Urban Institute based on existing Medicaid expansion states, the 73% number. That gives us that just under 1,954,000 new adults would be enrolling in Medicaid in the expansion program. So that's a lot of numbers. So just under 1 million is the one to keep in your mind. How many new people would enroll in Medicaid? Because that's the number we're going to use to translate into budget dollars. So the way that Medicaid financing works is that it's shared between federal and state governments. Right now, for expansion populations, the federal government incentivizes states to expand by paying $9 for every $1 the state puts up. Normally, that would be a 6-to-4 ratio in Texas about. And so that's a pretty big difference. It's a 90% federal match, is what kind of the wonks would call it. And that's been sweetened even more by the latest COVID relief package. As noted, that would increase the existing match by 5 percentage points and fully cover the expansion population for the next 2 years. That match has changed over time. Right after the Affordable Care Act was passed, for several years, the federal government was paying for everyone. But now it's down to 10%, and that's where it's set by law to remain. So we need to take that dollar amount. Then we need a dollar amount per enrollee to cost. We use estimates from Texas Legislative Budget Board, which is about $6,300 per person per year. And when we roll those up, we find that expansion would bring about $5.4 billion in federal money to Texas, and there would be a required state match of about $600 million. When we apply, say, the COVID relief package numbers to this, what we could say is that if we took the Kaiser Family Foundation estimates, which I think are kind of in the middle of what people are coming up with, that's about $5 billion in the increase in the federal match for the traditional, already covered in Texas populations. If you take my estimate of state share at $600 million, that means that the increased match could fully pay for the state share for the next 8 years at least. And that's before thinking about what I'm about to talk about next, which is offsets. And is the state share of $600 million mean that Texas needs to come up with $600 million in cash out of its own pocket to send to the federal government? So on that question, we need to look at, one, the experience of other states, and two, what types of existing avenues to coverage that expansion might offset or replace. So there are a few reports on this. This is not my work, but good reports that look specifically in Texas at the potential sources of offsets. These are things like if we know that that for part of a pregnant woman's stay in Medicaid, she can instead be enrolled in the expansion population, then during that time, the federal government will pay for her at the higher dollar level as opposed to the lower dollar level. And that's going to save the state some money there. And so we can add up those fraction of months and see how much of that 600 million they offset. So this is what offset means. It means there's another program somewhere that doesn't need to exist or doesn't need to be as expensive as it is now because of the Medicaid expansion, which is going to be paid more by the federal government. That frees up money over here for Texas legislature. If you look at the offset numbers, and this is, Janet talked about the letter that I had written with Dr. Ray Perryman and Dr. Vivian Ho about this issue, we see that the offsets look like they more than make up for the required state share. That means the state of Texas wouldn't have to come up with those dollars on its own. It would be paid for by offsets. Of course, that requires that, you know, there's some administration of this that ensures that when some money isn't needed over here, it gets reallocated over here, but the money technically should be there. So the COVID relief bill, of course, totally changes that because don't have to worry about it. So is this something affordable? Based on these numbers, it certainly looks like, yes, the state of Texas could afford Medicaid expansion. And certainly that deal gets even easier, that case gets even easier to make with the additional funds under COVID relief. I'm going to pause. Janet, do you have any questions?
I love that you got into the debits and the credits. So basically what you said was even without the COVID relief bill, even without this new incentive of the additional 5%, 95 to 5% versus 90% to 10%, with the COVID relief bill, if it's signed and if it's passed and if it happens, even without that, there is better than a net neutral. In other words, we can make the difference up from what we're overspending. If we were to change to Medicaid expansion would then pick it up or pick up a 90% of that cost, and we would no longer have to pay the cost for certain programs. And I'm not using my words as well as you did, but I'm so excited to see this. And yeah, I'm just so excited to see this because for at least a decade, for a long time, we keep hearing that we can't afford it. We can't afford it. And for y'all to have gone through the numbers and shown how it can be afforded. And I think the difference, it is revenue neutral, but it's something like a couple of $100 million to the positive. So we would save about a couple of $100 million if we were to expand Medicaid to 1.2 million factored by the uptake.
That's right. And, you know, it sounds a little too good to be true. And, you know, it's a little bit, you might be like, saves money, you know, that can make people a little bit skeptical sometimes. We have now many years of other states, including red states, that have expanded Medicaid. And we have evidence from those states, and we've actually seen this operationalized, that their expansions have not been as expensive as they thought, even though they were only expecting to pay a small share at all. And so, you know, this is not just like calculations out of thin air. This is also backed up by this reassurance of existing research on the effects of expansion on state budgets.
Janet, can I add something? I just want to clarify something. And it's actually, I didn't fully understand it because we're still obviously in the process of getting the American Rescue Plan through Congress and signed by the president. But that 5% bump, that incentive, is actually going to be applied to any non-expansion state to their regular FMAP. And that's actually more of an incentive than putting it on top of. So you'll still only get 90% for the expansion population, but you get an extra 5% for everybody else. In most expansion states, 80% of that impacts 80%. So it's actually a better deal. Like, put that 5% over for all of your non-expansion, your kids, your pregnant women, your people with disabilities, and you get the incentive for all of them. You'll get a 90% match rate for the Medicaid. But what I'm pointing out is that it is an unbelievably great deal. And Texas would be crazy not to take them up on it.
We have been crazy before. But just to hear that the debits and the credits work out, it makes me so hopeful. It makes me hopeful for not just pregnant women after they give birth so that they can keep Medicaid, not just for childless adults so that they can qualify for Medicaid, not just for people who have lost their jobs and once their unemployment runs out, they can now qualify for some sort of access to health care, but also for mental health, expanding mental health coverage, because so many of those folks are within the parameters so that they would also be getting some access to health care. It is just so big, and to wrap your head around that we can do this for the same amount of money as what we're spending right now and cover so many more people is just huge. It's a message that I want to try to amplify, and it's just it gives hope. It is so huge.
Yeah. If I could add just two more things, I might say that, this is just kind of calculating how this would impact, the state budget and things like this. There are other ways that this new federal money benefits the state that aren't captured through the state budget. So one of those big ways is that there is a level of care for indigent folks that's currently financed by counties through property taxes. And we've seen in other states that the need for these programs with Medicaid expansion is much reduced. So that can be leveraged in two ways. So one, the state can ask counties to help fund any potential share. Or two, counties can pass along any relief to their taxpayers, or, in COVID times, there might not be relief, but relieving some of the pressure from COVID. So a second way that gets passed through is, this is money that's going to healthcare providers. Those are businesses and people in our communities. And as that money filters through businesses and people, then we can see what we call multiplier effects. Basically, think of it as sort of stimulus on this small targeted scale. Dr. Perryman has a report about that. And I don't have his numbers off the top of my head, but he does have some calculations about the scale of that. And then finally, I just would wrap up by saying, I would teach my students not that a public program has to save money to be worthwhile, but that the benefits need to outweigh the costs. Of course, if there aren't major costs, then that makes a pretty easy case in terms of a cost-benefit analysis. But I think, just being cautious about setting too high of a bar for these types of programs is also something to note.
And I noted that in your language, your open letter to elected officials, a positive budget impact, which essentially says the same thing, but I understand where you're coming from. And you've given us so much great information. And I'm so happy to see you here. Thank you very much. I will mention that I am an Episcopalian. So to see those studies at the Episcopal Health Foundation that you participated in, that Dr. Perryman participated in, just made me proud. So yeah, great information. And those numbers from Dr. Perryman are big. I don't have it in front of me either, but it's in the billions of dollars in job creation, in an expanding marketplace, actual community marketplace by passing money around. We're also joined today by Sophia Sepulveda, and I hope I got that right. I really don't like mispronouncing names, but it seems to be a gift of mine, so forgive me, who is a health activist, a health organizer with Texas Organizing Project. And Meg, we've got some calls to action.
We definitely do, which is kind of what we wanted to cover today. Our biggest call to action that we wanted to emphasize at the moment is that we can save lives, save the budget, and expand Medicaid. You know, with this panel with deadly deregulation and the budget, as Dr. Daig and Melissa McChesney kind of mentioned in their panels, you know, we can save the budget. Through all these figures, through all these numbers, we've seen through hard facts that the budget can be saved. So for all the skeptics and the legislator at the moment, you know, we need to tell them through our calls to action that Medicaid expansion is possible and has a positive effect on us. And that's where our call to action comes in. You know, we want to hold our legislators accountable to say that you guys need to put our healthcare, Texan healthcare first, and put the millions of adults who do need Medicaid first. And this is kind of where our call to action comes in, where during this age of COVID and this age of deadly deregulation, because our state leaders are prioritizing business over Texan lives, we clearly need to choose Medicaid and Medicaid expansion because it's the smart choice. You know, we have a positive impact on the Texas budget. Texas can save millions and hundreds of millions of dollars even. And during our budget crisis at the moment with COVID, you know, we have a lot of restrictions on the budget at the moment. This would help us and this would relieve our stress for the budget. So what we wanted to kind of tell viewers today is that you need to make contact with your legislators, tag them on social media, tag them on Twitter, Facebook, and use the hashtag deadly deregulation. Tell them that Medicaid expansion is good and that we should do it. You know, tag Indivisible, tag Sick of It Texas, tag us. You know, all of us, we need to work together to expand Medicaid because obviously we have millions of lives here at stake and we want to save lives. And that's kind of what our call to action is kind of coming at right here. So find out who represents you, talk to your state representative, talk to your state senator, and tell them, okay, Medicaid expansion is good. Here are the facts, and here's why we should do this. Here's how it affects me. Here's how it affects my community, or here's just why it works with Texas. Here are the hard facts. And clearly with Dr. Daig's presentation, with Melissa's presentation, you can see that the hard facts are there. We just got to get it to the people who represent us, the people who can do things in Texas. And that's what we're here for. So we just wanted to kind of mention this call to action. And also with the current mask mandate removal that's happening right now because of Abbott's decision, we also have a call to action on that. You know, tell your representatives that removing the mask mandate during COVID, during when insurance is so hard to find for so many adults, all of this ties together. You know, we need to prioritize healthcare first. And by removing the mask mandate, we're not prioritizing healthcare. We're not prioritizing Texan citizens. So let's do that. Let's prioritize the mask mandate. So please just look at our calls to action. They're all on the Indivisible TX Lege website if you want to check them out. We also have a bunch of scripts that you can write to your state representatives, state senators, or call in case you need a reference for, you know, just getting started for what you want to put in your message. And that's what we really wanted to emphasize during this panel.
Meg, thanks so much for highlighting those actions. They've been posted in the comments. Sophia, with your presence with the Texas Organizing Project, that's exactly what y'all's amazing organization really helps make happen. We have this content from Every Texan, Melissa with Every Texan, Dr. Daig with the Bush School of Texas A&M. Sophia, talk to us about how y'all at TOP are really helping Texans get the information and understand how important their actions can make a difference for our state.
Of course, and thank you very much, Alexander, for having me on this panel. I've been organizing with the Texas Organizing Project for around 2.5 years, and I ground game is pretty much going to communities of color, low-income communities, and talk to them and organize and activate them into taking action, kind of like what Megan said. And I agree, we need to ensure that we are ourselves taking action, but tell your friends, tell your families. There's a lot of folks that you might be around, that is your circle. And they might have stories. Tell them to share their stories about how would they benefit if we expanded Medicaid. Like we were mentioning earlier, Texas have the highest number of uninsured in the country. That is not just for adults, but for children, most of whom are Latino folks, people of color. And those are the folks who are also in the forefront of this pandemic, right? Like they're the grocery shoppers, the gig workers. They're the ones who are facing the brunt of deaths when it comes to COVID-19. So yes, we need to ensure that we are not only taking action ourselves, but telling our community. What we do in Texas Organizing Project, again, is going to community, educate them about the benefits of Medicaid expansion, and collect stories. At the end of the day, stories, personal stories about your personal experiences, what causes or what has the most impact when it comes to talking to representatives. It is your stories that will move a representative from maybe being ambivalent in supporting Medicaid expansion to being completely supportive of the legislation. Also, I want you to understand that even with Medicaid expansion, we will still have around 3.3 million Texans without insurance. So this is not the end of the fight. This is some part of the fight, but it's not the end all be all. We need to continue pushing in order to ensure the rest of our community continues being safe. I like to always say that we are as strong as our most vulnerable, and our most vulnerable right now is suffering. And that is the truth. Our immigrant communities will not have access to the Affordable Care Act. So we need to ensure that we provide some benefits, kind of like what they were talking about, the indigent health system. In San Antonio is CareLink, in Harris is the Golden Car, in Dallas is Parkland. Research, ensure that you're telling your friends who are immigrants and not have access to these benefits, how they can get access to healthcare. It's important that we protect our vulnerable, but we are ensuring that we are taking action.
That's awesome, Sophia. And we're pretty sure everyone knows about Texas Organizing Project because of how amazing you guys are. But if you don't, Texas Organizing Project is really leading a lot of great work, as Sophia mentioned, specifically in our brown and black communities, where we desperately need everyone to commit to doing more work in those spaces, because there are so many opportunities to engage voters, but also to help address a lot of these issues that we're seeing. That includes, the opportunity with Medicaid expansion and healthcare access. We have had such a great conversation, but we have a final topic. If everyone is able to stay on just a tad bit longer, and really tie all of this together and really just kind of open it up for everybody. And this is around just, why do we call this hashtag deadly deregulation? And this is a theme that we're following after the Texas Freeze event, that we want Texans to understand that it's not just the Texas Freeze event where we've had deadly deregulation, but it's in all of these other issue areas. And it's really our Texas leaders' lack of willingness, lack of desire to actually do the things to pass sensible regulation, to have sensible accountability in all of these different spaces, so that Texans' lives are not compromised. And we are absolutely seeing this in all these different ways. And so we'll continue to have content from our different issue huddles. But when we look at healthcare specific, it's been mentioned, the mask mandate has been lifted. Today is the beginning of that, to where masks are no longer required in Texas. We've seen a lack of coordination and regulation with vaccines, where, Sophia, you're talking about those communities that are, deeply impacted. They're on the front lines, they're doing the working, but we're also seeing a lot of data come out to where they're not the ones getting prioritized to get the vaccine. And there's disparities in that distribution. And then just COVID-19 response in general. What would y'all like to share in terms of why it is important for state government and state leadership to have sensible rules and regulation when it comes to healthcare, especially during a pandemic, and how we interact with all the different phases of this pandemic? Whoever like to go first.
I can start with a few thoughts. If I go first, I feel like I get to some of the easy ones. So a few things here. One of the goals, I know that we're talking about like where we are right now. Let's get the vaccine out. There's certainly been a lot of hurdles in us doing that here in Texas, but the ultimate goal is herd immunity. And I have very large concerns about getting to that here in Texas because of our high uninsured rate. And because of a lack of leadership thinking about the perspective of all Texans. So, for example, prior to the pandemic, we actually saw a decline in children being enrolled in Medicaid and the Children's Health Insurance Program. And we know that the biggest driver of that, based on the data, was fear from mixed status families in contacting the government, accessing government benefits. So we've tried to ensure at a more local level that when folks are talking about testing or when folks are talking about vaccines, that it's clear that it's free and available to anyone, regardless of their immigration status. But without a top-down leadership approach and getting that message out to folks, we really just don't feel like it's going to permeate through all of the different communities. And then even setting aside fear from mixed status families, and that's a huge number in Texas. I just want to put a number to that. 1 out of every 4 kids in Texas has at least one parent who's not a citizen. So we're talking a large number here. And then, so setting that aside for a minute, if you're uninsured, you may have no sense that the vaccine is available for you. Or even if you do, you may not have a health home. You just don't interact with the healthcare system in the way that historically insured folks do. So we're starting this race to get to herd immunity way behind other states. We made policy decisions that are going to make this considerably harder for us. We have some options. We have some levers here that we could be pulling that could make it where we could start seeing some progress, but I'm also not seeing leadership take that urgency seriously.
And going to what Melissa said, right, that is part also of the public charge rules that were changed under the Trump administration. We just saw last week that Biden is actually rolling them out. So yes, do tell your immigrant friends, your immigrant families, go seek that help. First of all, if you were to enroll on Medicaid, it wouldn't affect your public charge, right? It wouldn't affect your immigration status. So that was a fear mongering coming from our main person in charge 2-3 years ago to put fear on immigrants' families in order to deny them access to healthcare. As we know, they're the one in the forefront. They're the ones making your tacos at your favorite taco shop. They're the ones bagging your groceries at the Hero HEB. So in order to protect ourselves, we need to protect them. If we are going to that taqueria to buy those tacos and we are getting that food from folks who are already sick with COVID and we don't have the vaccination because we are not in the 1A or 1B, then we can get sick. So we need to ensure that not only doctors, nurses, teachers, but also frontline workers, healthcare workers, grocery workers are on the 1 and B rollouts vaccination, because it's super important for us to be safe by keeping them safe.
And I just want to add that yesterday were huge news that the public charge rule was entirely vacated from the courts. So yes, big news that the current nationwide stay on that rule that comes out of Illinois is currently in effect. And we have every expectation that rule will be completely taken off the books by the Biden administration, but it's not in effect. So yes, shout that from their rooftops, because it's made a huge difference in people feeling safe to access healthcare, which is what we need them to feel right now, so that will go get tested and they'll go get vaccinated. And they'll just go to the doctor when they get sick. These are basic things that people are afraid to do because of the environment that we came into the pandemic with.
I might speak briefly to the COVID recession a little bit and how to think about social safety net and social insurance programs at this time. I think that the pandemic has highlighted for many people who maybe never thought that they could suddenly lose their job or their business. Many many restaurants and shops that were doing very well prior to this have really struggled during this time, not because their business model was bad, but because of this external shock that's really affected them. This is the kind of thing that social safety nets are built for, to try to help people not fall further and further behind so that they can push themselves back up when they have a temporary setback, which hopefully the pandemic starts to become more temporary as we move forward. And as we think about programs like Medicaid, like SNAP, like unemployment insurance, that's the role that they're meant to play for folks. We see that a lot of people who fall into a path of poverty do so because they have a shock that happens to their family, a health problem, a job loss, a divorce. And it can be hard to climb back out of that shock that happened for reasons external to them in many cases, without programs and supports to be there for them when these happen.
It's such an important point to make, Dr. Day, because it's the ripple effects of being in a pandemic. And when we're not looking at how we can go through this together, and versus what our Texas leadership is doing is saying pretty much every person for themselves. I think even Governor Abbott had one of his subtweets to his announcement of like, personal responsibility. That's what's going to be needed. And I got a little infuriated over that. I'm being modest. I was very infuriated over that because we have all of these other things that we do together as a society, whether it's our traffic laws or whether it's, other aspects that we do to where we can do these things together to make sure that we are safe and able to, interact and function together. And so a pandemic it's been huge. It's going to be going on a year now. We're having an anniversary for a pandemic. We still don't have everyone vaccinated. And so the ripple effects are going to definitely continue. And we have to understand this is why government has a role to make sure that we have clear, if it's regulation or whether it's rules or whether it's expectations, guidance, a vision. That leadership has a huge part in helping all of us work together to get past this pain point that we're all having. And there's different levels of suffering that are happening throughout our state. And so thank you so much for highlighting that. And Melissa and Sophia, the excellent points that you guys are making as well. I want to hand off to Meg, because I believe she has a question she'd like to ask you guys as well.
Thank you so much, Alex. And as Alex was mentioning, obviously the government is such a big point in, this deregulation and Medicaid expansion, all these like safety nets, these fallbacks, as Dr. Daig was mentioning. And this kind of shows how big the government's role is in everything relating to healthcare, especially in Texas. And this kind of poses a question, we need to emphasize how governments would benefit, because obviously, as kind of seen in the past with like all the stuff happening with deregulation and happening with Governor Abbott, clearly the government prioritizes themselves currently over the healthcare of Texans, and that kind of causes the concern that like what would kind of help them get motivated to help Texans with their priorities, right? And I just wanted to ask, how do you think that legislators would respond, and like how would they respond? Like not exactly how, but yes, how, but also like what would they respond to? What do you think would be the trigger? We have these stuff relating to emotion and, the personal experiences of Texans who are uninsured, Texans who are unemployed due to the pandemic, who have all these shock factors, as Dr. Daig was mentioning. And, we have the immigrant workers who are working at your grocery stores, who are working like at your frontline jobs, your minimum wage jobs, who are working for the Texans who are currently living in the state, who are working for the governors who go to their local taco shop and buy a taco, for example. And I just wanted to ask, like, what do you think would push them to kind of make this decision? Okay, let's expand Medicaid. And I wanted to kind of dive into that. Like, what role does the government play in, the welfare of Texans right now?
I think the government plays a pivotal role in keeping not just Texans, but our whole country safe, right? Especially during a pandemic. And we see how unprepared was not just the Trump administration, but it's unprepared right now to handle a pandemic of such big proportions. We saw how Italy nationalized the hospital system in order to be able to provide not only PPE to the hospitals, but also provide them with oxygen tanks and ensuring that folks were taken care of. So we need to definitely, especially during a pandemic, we need to decentralize and nationalize our system in order to take care of everybody. Another thing that we can do in order to push this these representatives to do something about Medicaid expansion is continue calling them day in and day out. And again, not just yourself, mount the pressure, get to know we always say we get to know the enemy. How do you get to know the enemy? Follow them on Facebook, know when the next town hall is going to be, show up, disrupt. We need to start disrupting their lives in order to make them understand how disruptive our lives has been, because they have not taken action on expanding Medicaid. We see them right now trying to push for legislation that oppresses trans individuals with this anti-sport trans bill that they're going to present on the House. Instead of doing that, we should really focus on expanding Medicaid and providing access to healthcare to our people. This is nothing, the transport is nothing but rhetoric in order to push more fear to our population, just the way that Abbott is doing when it comes to lifting the mask mandate and immediately saying, if we have a spike on COVID, it's because Biden is releasing immigrant folks who have been tested positive for COVID. And we know that is not true. So he's setting up the stage to start pointing the blame. And we need to start fighting back on that rhetoric, pushing back with this representatives and calling them day in, day out. Show up to their houses if you know where they live. Disrupt their lives as much as they're trying to disrupt ours.
I would just build on that. That's exactly. So earlier we talked about, who's the benefiter, why have we not expanded Medicaid? It's really, it's entirely political. The Texas Association of Business has supported Medicaid in the past. Health plans support Medicaid, providers support Medicaid, hospitals support Medicaid expansion. So even the business community wants this. We've seen the economic drivers that can come from it. So really, it's an entirely political decision. And one of the things that I think we see in Austin is that the representatives and the senators think, well, nobody in my district wants Medicaid expansion. So what we need is people in the communities calling their representatives, calling their senators and saying, yes, we do. Because I think there's we just saw a poll coming out where nearly 7 in 10 Texans supported some version of Medicaid expansion. We need them to understand, and that needs to be real for them. We need that public opinion that has been growing and growing, where more support for Medicaid expansion. We need that to feel real for them. And they really do. They will tell you, I want to hear from somebody in my district. So they really do want to hear from their own constituents. And so that's why we have, partnered with TOP on the Sick of It Texas campaign to try to help provide the tools needed and really, lift up the voices of the community, because that's really so that's why calls like this are so important, because that's what's needed right now, is for them to hear that people in their district care.
Let me take myself off mute. Thank you so much, Sophia and Melissa. We have had such an amazing conversation and panel for everybody to be able to have. We're going to dissect this, and that way people can have the different pieces so that they can share it and make sure that they're helping other Texans continue to get to know this. Also send it to their legislators, because we have the experts who are giving them the information so it's clear. Before we go today, are there any final comments that y'all would like to make around this topic and everything we've talked about? And once again, thank you so much for the extra time today with this panel.
All I'd like to say is not only follow Indivisible, and thank you very much for the invite, but go to www.sickofitexas.com, which is Sick of It TX .com. It's not Texas spelled out. And find out what events we're having, find out what calls to action we're having. We are trying to hold not only Abbott, but Patrick and Paxton accountable. And what a lot of people also don't know is that Abbott can actually expand Medicaid today with just the stroke of a pen. That's the power that he has right now, right? Like we also saw how many Republicans have come out in favor, including Lyle Larson, who is in San Antonio, in favor of Medicaid expansion. This is not a partisan issue anymore. This is bipartisan, and our people are dying. We need to take action. We need to take action now.
Kind of going off of that, thank you so much, Sophia, for joining us. You know, I wanted to go back to what Rep. Busey said at the very beginning of this call when he made his little introduction in the video. And I wanted to just kind of emphasize that we have so many issues. As Rep. Busey was saying, we have so many issues regarding, you know, the Texas freeze, we have the voting situation, we have the budget crisis currently, we have Medicaid expansion. Amongst all those issues, if we did solve Medicaid expansion, we'd have a good amount of healthcare concerns that would be solved in Texas. And that would greatly alleviate legislators from all the pressure they're feeling right now during this last session. You know, during COVID, I'm pretty sure this virtual environment, them having to think of their own health precautions and others, they're probably very pressured at the Capitol right now, trying to work through this last session until May, June. And so we need to do our part and tell our legislators, this is how you can alleviate that pressure. You know, you can help the budget, you can help Texans. And, you know, with everything that's going on, Medicaid expansion has so many sub issues in it. You know, we can help with the budget, we can help POC and marginalized communities, we can help minimum wage, full-time working families, we can help those in the front lines, we can help veterans. You know, to support those 1.3 million people in Medicaid that it could be expanded to, it's roughly equivalent to the Dallas population, as we were saying. So it's so important to understand how this affects Texas, and keeping that in mind, you know, tag your representatives on social media, tag everyone, go to Sick of It Texas, look at their calls to action, follow that, go to Indivisible, look at our calls to action, and then follow that. You know, every Texan also has some really good resources. Please just check them out. You know, we all have the resources needed to help contact our legislators, but it's you guys, the people watching, you know, it's Texans that will actually make the difference. So we have the resources, so we have to take action now, and we need everyone's help to do this. So we just wanted to emphasize that. We got the budget issue, we got the social issue. Now let's just bring it together and contact those representatives.
Well, thank you so much, everybody. Once again, this has been an amazing panel. As Meg said, let's take action. We need everybody. If you have any questions, or you want to continue to, you know, have information spread, reach out to Indivisible TX Lege. We'd be happy to help out with that. Sophia with TOP, the Sick of It Texas campaign, you can reach out to them. We want to continue to get this information in front of Texans. Thank you so much, everybody, for your time. We really, really appreciate it.